Go to Healthworks.
At Healthworks, we're going to utilize a Kincom machine. It's a device that we use for exercise and evaluation. We're going to use it for the knee today. It can be used for knees and shoulders, hip evaluation exercise. It has different forms of exercise that we can do on it. We can do isometric exercise. We can do isokinetic exercise, which means we set the speed of movement, and patient, as soon as they reach that speed, like if we set it at 30 degrees per second, as soon as they reach that speed, then they get resistance. So the faster they try to go, they can't move it any faster than 30 degrees per second, but they get more resistance back from it. So we use it in different formats. We can also let the machine do all the work, put it in a passive mode, and we do that sometimes with patients like total knee patients where we want to move their knee and we want them to do nothing. So we can move it passively with our hands, but sometimes we'll put them on this machine and the machine does the work then. So I'm going to set Kristen up now in the passive mode and let the machine do some work for her. And so we push passive, we push continuous, and we have to set the range of motion. So we set it out at a comfortable limit, push the enter button, and then we set the flexion. And we can change the parameters on this machine. Right now it's set at 10 degrees per second. It'll move her both in extension and flexion. We hit start exercise. And now the Kincom machine is moving the knee, and it moves it to the stops. And again, we can make this faster or slower. It can go up to 240 degrees per second, which is rather fast. And we usually passively, when we use it in the passive, we like to use it at somewhere between 10 and 30 degrees per second, so they move slowly. So the other thing, we're going to stop the exercise here, and this is nice because on the screen you can see it counts the number of reps, it counts the sets, and again it has the speed forward and backward, and we can see from the screen in the passive mode. Go ahead, Kristen. When it's coming up this time, push a little bit. So you can see that she can put some light resistance on in the passive mode. Now pull down on the way down. So she pulls down gently. We can set the stops if we don't want her to pull too hard or in the flexion or up to push too hard into extension. We can set force limits. So the machine would actually stop if she pushed too hard. So we'll stop the exercise. We'll finish that. And we'll go to an isometric mode next. So again, we set limits, and we can set different spots that we want her to push. So every few degrees we'll put little stops in here. And then we set the start angle down here. And now she's going to have to push with a minimum force of 22 pounds to get this to move. So we can set that the minimum force, so we can set it less if we want to, so we're not making her work too hard. And we can change that at the different spots too if we wanted to. So we're going to start the exercise. So if she pushes, and you can see that she has to push at least 10 pounds, then it relaxes, and then it takes her to the next point. Okay, so it's a 5-second hold. She has to push at least 10 pounds. So that bringing 10 pounds brings her up into the blue area. And it's a little bit harder as she gets out into extension to push. So if we wanted to make it harder, we'd make it harder on the first few points. And again, we're doing one set of 3. So go ahead and push, push, relax. Okay, this time don't push hard enough, Kristen. Relax. So it stops counting. So until she gets 5 good seconds in the blue area, it won't move on to the next point. Okay, so that's 2. One more set of 4. We could also put a force limit on this if she pushed too hard, where if we didn't want her to push with too much force, we could limit that force and it would actually stop her if she pushed too hard also. Okay, so we're going to stop that exercise. And now we can go to an isotonic mode, which means we're going to set the speed, and when she reaches that speed, then she gets forced back. So we can keep it on continuous and do exercise with it. And we'll do some for knee extension. And we'll set an end point, and we'll put a starting point in. And so we're going to have this at 30 degrees per second. So we're going to have her push forward to make it move up, and then she's going to push into extension to make it go down also. So this is like a concentric, eccentric type exercise. Push up, that's right. Push. Okay. So she has to push into extension. She has to extend her knee to make it move up, and she has to push to make it move down also. So the normal feeling that you get is when you want to go down, you pull down. But Kristen has to fire her quad muscle to make it go down also. Okay, relax. I'm going to take this off of the unstrap her. Go ahead and take your leg out of there once. So when I'm pulling on the cuff, if I pull it up, it comes up. If I pull it up, it goes down. So that's what was happening when Kristen was pushing. She was extending her knee to make it go up, extending her knee to make it go down. So that's the Kincom machine.
When your body hurts, go to Healthworks.